Alrighty, so this week's residency reflection. Start off by kind of apologizing quick for the first take video. Kind of swore towards the end there, had to bleep it out. But I wanted to kind of keep that in there just to let you guys know that when I do those first take videos, that's my initial thoughts. I'm not trying to, you know, powder it up or anything or put lipstick on a pig, and I was pretty excited about that, but sorry about the swearing in towards the end there. So this week's residency reflection. So first full week in the clinic, first week with kind of having something consistent every day, and it was exciting. It's nerve-wracking a little bit, but it's definitely exciting. So we ran some open labs last week for the class that I'm helping teach, and then we also had to administer practicals. Students did great on the practicals, so that was kind of nice to see that they're understanding the concepts, and it was also kind of nice to be on the flip side of it and not having to take a practical, but rather having to kind of give one. And I thought it was a good culmination, like from of the semester so far, and I felt like it was really cool to be able to see things from kind of the other side of things and not from the student perspective, and how making sure what we're doing is actually working through the test questions, through the practical scenarios and cases, and then kind of just seeing how all that comes together and how the faculty, you know, how we all kind of sat down, reevaluated, and said, okay, what do we need to maybe change the second half of the semester? Kind of talking to the students, seeing what they thought. So that was cool because I know, like, as a student, it's just like you get to midterms and it's just like, let's just get through this. I don't care about anything the next week or two other than getting through these practicals and these tests. And as a faculty, it's kind of the same way. You're stressed about getting the exam ready. You're stressed about checking over the cases for the practical, making sure all the faculty are on the same page, making sure all the grading's good, making sure that students are getting the concepts, and seeing if there's anything you need to change for the course for next year, which I won't necessarily be involved with as much, but some of the main faculty for the course are thinking about that. And so I guess the message to students is you're stressed, and there's probably a little more stress on the students, but there's a lot of stress on the faculty around test time and practical time and stuff like that too. So you're all kind of sharing in the stress. It's not like they're trying to just be mean and dump stuff on you. So in the clinic, we got to see our first patients last week towards the end of the week. So kind of did some shadows / co-treats / basically just getting oriented to the hospital towards the beginning of the week, and then towards the end of the week, a little bit more of diving into the electronic medical record, learning how to document, learning the billing, and then getting to treat with one of the therapists kind of watching us on the floor, just making sure that we were kind of going through everything, answering any questions that we had, and making sure we hit all the points with documentation and stuff like that. So I thought it was a really good kind of slow introduction. Excited this upcoming week we're going to get to build our caseload and start to get patients put on. So last Thursday, as you guys saw in the first take video, got to treat my first patient, got to officially sign a note as Jonathan Rippick, PT, DPT, without a co-signer, so that was super cool and awesome. And this next week, I think we still have our buddies, they're calling them, kind of helping us out where we need it, being there as a resource with us, but transitioning more to that just independent care, and they're kind of just there with questions and to help us ease into it a little bit. But so excited for that, excited to keep building the caseload and start actually treating and feeling more like a PT as well. When you got to sign that first note, it was like, okay, like now I'm actually a physical therapist, and like I can actually say I'm a physical therapist, not just be like, oh, I'm a physical therapist, but then in the back of my head being like, but I haven't actually seen anybody. So that's kind of nice. Looking forward to that. It was a good week. It was an exciting week. Might be doing some stuff with some of the students that I'm helping teach with some breathing things. Still trying to get that in the works. So excited about that, and excited to get going this next week. And then this is the last week before we start our mentorship sessions in the clinic with the residency, which is once we hit that point. So after this week, going into the next week, we'll be full on 100% everything on the residency, firing on all cylinders. So hopefully that comes quickly, because I'm excited for it. It's definitely going to come. But I'm excited for it, and hopefully this next week is kind of a good, smooth transition into building that caseload and getting back into the teaching in terms of the second half of the semester and not just reviewing. But so yeah, still loving it, still super excited, not overly stressed out yet. I think I've been doing a pretty good job of staying organized and keeping myself held accountable. This whiteboard full of stuff on it helps me, and reminders and stuff like that on my phone. So not too overwhelmed yet, still feeling pretty good, pretty confident with everything. Still nervous, but I don't think that nervousness is going to go away. Hopefully the confidence and the feeling like I can keep up with everything continues. So that's this week's residency reflection, and be on the lookout for the quote of the week and the research spotlight, and might have another video or two kind of towards the end of the week. But thanks for watching. If you have any suggestions on videos or anything that you want to see, feel free to put it in the comments, and thanks for watching.